Ladies and gentlemen, today I'd like to talk about the health facilities and medical services in Uganda. As you know, I did speak very briefly about this when talking about the typhoid epidemic. But today I'd like to concentrate on the general services in Uganda as a whole. In the 60s and 70s and the late 50s, Uganda had a very robust health system. Mulago Hospital was renowned throughout the world. Makerere Medical School was a center of excellence. However, unfortunately, I cannot say the same now. Over the last 30 years, the medical facilities have progressively gone down under the reign of Dictator Museveni. The health facilities have been neglected. The health sector funds have been stolen. Many of you know about the Global Fund, where more than 600 billion Uganda shillings was misused, stolen, or misappropriated. In addition to that, the other funds, like the OPM, where more than 230 billion Uganda shillings vanished. In addition, from the national budget, there's supposed to be 8.4% allocated to health. This works out at about $51 per person. In reality, probably would be lucky to have $10 per person trickling down to the population. And the rest is plainly stolen. Pure and simple theft, and corruption, and mismanagement, and incompetence by Dictator Museveni and his henchmen. This obviously leads to deaths. Maternal deaths, child deaths, neonatal deaths, cancer deaths, HIV deaths, accident deaths, and deaths due to infections acquired in hospitals because of unhygienic conditions. It's not uncommon if you go to Kawolo or Kiyingi hospitals or many other hospitals in the rural areas to find that sewage is flowing. Now this is a health facility, and sewage is flowing, which breeds disease. It's not uncommon to go to theater and you come out with a serious infection because the theater was not sterile. It's not uncommon to go to an emergency ward and you actually die because of lack of facilities, no blood transfusion, or unhygienic conditions in which drips are put on. You'd be lucky to get a bed, you'd be lucky to get a mattress, and many of those mattresses and beds and bed sheets are dirty. It's not uncommon to get vaccinated with vaccines which are either expired or have gone bad because of poor storage due to lack of electricity in the storage facilities. This is pure negligence. This is murder of the general population by Dictator Museveni and his men. The medical people are overworked. One doctor serves 7,400 Ugandans. One midwife or nurse serves 37,000 Ugandans. This is unacceptable. The medical professionals are not well looked after. Their salaries are delayed. Training is progressively getting bad because of poor facilities and funding. Housing is poor, and you expect these people to work with an overloaded system. However, when the daughter of the president When the daughter of Dictator Museveni needs medical services, she's flown to Europe for medical treatment on your money. Ladies and gentlemen, I could go on because, as you know, I'm speaking as a doctor now. However, I want to ask you, I want to challenge you today. Are you happy with the medical facilities in Uganda? Are you happy with the dirty hospitals? Are you happy with the non-functioning theaters? Are you happy with the non-sterile theaters? Are you happy with the sewage flowing on the floor or in the toilets in hospitals? Are you happy using unsterilized equipment? Are you happy for your women to die during childbirth because of poor facilities? Are you happy to die in the emergency ward because there's no blood? Ladies and gentlemen, if the answer is no, then I want you to join me. Not tomorrow, today. The time is now to make a change in Uganda. Under my administration, there will be regional hospitals, there will be district hospitals, there will be county hospitals, and there will be county health facilities and sub-county health units. We shall bring health service to the people. Medicine will be checked properly so that expired or dangerous medicine is not given to the population. Corruption is going to be stamped out, and the medical professionals are going to be well looked after in order for them to look after you properly. And now I'm not just speaking as an aspiring president, I'm speaking to you as a medical professional. This will be done. So, ladies and gentlemen, if you want a change, if you want a healthier Uganda for yourself and for your children, this is the time for us to boot out Dictator Museveni. God bless you.